We understand at Second Nature that family involvement is not just rewarding for parents, but also imperative for change and sustained change. We involve parents from the very beginning, from letter writing to encouraging and recommending reading assignments, writing assignments, group and therapy participation at home, to involving them on weekly phone calls. We have twice a week webinars provided for families where one time a week is an open form of question and answers, an interactive experience. And the other webinar is a topic-led session where you can still make comments and ask questions live. You can also look at our vast library of archived webinars to learn about your child's diagnosis, how the wilderness process works, how to deal with your child at home. We also can provide, upon request, mentors from parents who are grateful and have the experience who've gone on before you, and they can offer support, especially during that difficult and trying time in the first 72 hours. We also involve the parents at the end in a graduation process, providing them with treatment recommendations, with a written report, with communication with the next professional who's going to take the therapeutic baton, if you will, and carry it on for the success of your child. We encourage the use of an educational consultant to make sure that they can quarterback and choreograph this entire process so that it's a seamless process all the way through to your child's successful independence. What happens out in the wilderness day to day? You know, a lot of times people think about therapy as what happens inside of a therapy session. Even in individual therapy, some of the most important work that is done is what happens between two therapy sessions. Sometimes the kids will say, I wish I had more time with our therapist, but sometimes therapy can become a distraction. And although the therapist is going to create a treatment plan based on traditional and classic therapeutic theory, they're also going to use the experience out there. And so when your child wakes up in the morning, they have to break camp. They have to cooperate. They have to solve problems. They have to deal with frustration. They have to deal with directions from staff to break camp in the morning, to make it look like we were never there. We practice low-impact camping out in the wilderness. So they break camp in the morning. Oftentimes they'll have an initial group to set the tone or theme for the day, and then they'll set out on their hike. Hikes, depending upon the season and schedule of the specific group, can range anywhere from a short half-mile hike or a day hike where they go away and come back to the same site to a 9 or a 10-mile hike during a specific challenging part of the program. And it's throughout the context of these day-to-day living experiences that therapy comes up. That children learn how to communicate. That children learn how to problem solve. That they learn how to express themselves without the need for displaying symptoms. They also participate in academic curriculum while at Second Nature. They have time for individual therapy assignments, reading and writing, and also time for letters. We provide them with the best gear to make sure that they're safe. And you can't take anything for granted. Anything from taking a shower to cooking a meal takes cooperation, patience, work, and really a group focus, a reliance on the community that they're in. And it's different, folks. It's different to be in therapy with somebody who you need to rely on to survive. The staff members trained in CPR and first aid and also qualified as a wilderness first responder are taking care of your children. They're there for 8 days with 6 days off. Provide a very comprehensive, cohesive, and seamless frontline treatment staff. The therapist that is visiting the field twice a week, creating and adapting the treatment plan for every child every week, communicating back with the family, making sure that the family is aware of where the child is at, diagnostically, who the child is, and prognostically talking about what the next step is going to be for the child. Communicating with the education consultant and their area of expertise, which is out-of-home placement, making sure that this is not just a short-term change. This is a long-term gain, something that a child internalizes from the inside out. So Second Nature is an ecosystemic approach. utilizing wilderness therapy, classic and traditional therapeutic models, a positive peer culture, staff mentoring, and family to make sure that you and your family are on the way toward hope, optimism, and positive change. We want you to explore wilderness therapy. We want you to explore second nature. We want you to ask tough questions. You have a right to do it. As a consumer and somebody who is lending the most precious thing in your life to another professional, your child, we think you have the right to ask tough questions. And we want to have the opportunity to answer them. Talk to our admission staff. Talk to an educational consultant. Ask about safety record. Ask about clinical experience. Ask people why and how this all works. And listen to the answers. Wilderness therapy is an intuitive model. But beneath that intuitive model are strong theoretical and clinical foundations. One of the most common questions that a parent will ask me when considering placement of their child at second nature is, will my child be angry? Will my child forgive me? And I want to tell you, second nature and wilderness therapy is a gift. It's an opportunity for your child to learn who they are, to feel better about themselves, to learn how to be happy without the use of symptoms or substances. Sadly, the most difficult thing in life hasn't happened to children in most cases. They have a lot of challenges ahead of them. And so what second nature does is it teaches them how to feel. It teaches them how to talk about their feelings. It teaches them how to connect to people. It teaches them how to problem solve. It teaches them how to cope, all in the context of primitive living. So we welcome you to this process, and we welcome you with our hearts, understanding how challenging this can be. And understand this, your child will forgive you when they get healthy. They'll forgive you for the mistakes you make, and they'll thank you for starting them on the path. Starting them on the path in second nature and the path toward success and connection. Good luck to you, and we hope the best.